Hello, my name is Christine Eck. I'm the director of the Center for Sacred Window Studies and the Postpartum Care Collective, and I'm so happy to be here with Chelynn Tetreault, who is my friend and a directory member and an amazing Ayurvedic practitioner. She is the founder of Lotus Ayurveda and works here in Western Massachusetts. Thank you, Chelynn, for being here.
Oh, I'm so happy to be here. Thank you, Christine.
Yeah, it's amazing to have you. I've known you for several years and, through the Ayurveda community and our local community here, and to be working in this field now that is so virtual, working with students all around the world, and to be able to have somebody like in my town feels amazing who's doing this work. And you have really taken your Ayurvedic practice so far and have become such an expert in this field in Western Ayurveda, the marriage of the two. And I would love to talk to you today about immunity and staying healthy during pregnancy and postpartum amidst this time of coronavirus. And I know that this is on the minds of a lot of people out there, and also caregivers, doulas, who are trying to work with families. Yeah, thank you so much for talking with me about this.
Oh, of course. Yeah, I think so. When you're saying it's been on the minds, or it is on the minds of a lot of pregnant families and birth practitioners and doulas, I think that's a good point, that we need to really work with and support the minds of people just as much as their physical health. And I do really feel for pregnant families right now, because they've had to deal with a lot of, like all of us, a lot of sudden changes. And when you're pregnant, all you want is a feeling of stability, because you're about to go through a major life change. You're bringing a new life into this world. And so to have this global pandemic hit, I can only imagine how that must feel. One of the positive things that I've seen happen, and it definitely needs more attention, and there are people doing work to try to bring about change, but I've noticed, at least in our state, I don't know what you've seen, but there seems to be like more of a move now towards families choosing to actually look for other birthing options, meaning deciding to have a home birth midwife, because it creates a more of a sense of safety for them, because they'll be around, they won't be in a hospital setting, which is a place people go to, where sick people need help for the most part. So I really like that that's happening. There's like movement that's happening to redefine what birth is for people, that it's actually something that is full of health and needs to be supported by comfort and care, and creating a calm place for the birth family and for the person that's giving birth. So that's just as important as taking care of the physical immunity. So in Ayurveda, we have an understanding of our physical immune strength, as well as the immunity or the strength of our mind and emotions. People call this ojas. It's just a word, but that ojas kind of encapsulates this idea of strength of the mind, strength of our expressing our emotions, feeling our emotions, and also our physical strength and ability to withstand the stresses of life and any kind of like pathogens or infections that we come across. So that's one positive, seeing a movement towards more people deciding to have home births, which I think is great.
Yeah, I so much love, and I think so many people are going to have a different revelation about home birth than would if this hadn't have been the case right now.
Right.
And I also really love that idea of birth being full of health. Birth is not a condition of illness where we need to be patients. Birth is full of health, where we let the body do what it knows how to do and provide the best environment for the body to use its own wisdom to make that happen.
Exactly. So I think for birth families to try to cultivate a calm environment for themselves is helpful. And I hope that there's going to be an increase in support for families. I know that a birthing center recently got shut down, and that's really, oh, it's in a way, it's very discouraging, and it's very concerning because a lot of families that don't have a lot of resources and maybe struggling financially now don't have the center. And so I have noticed there is a coalition of people that are working together to try to mediate that and to try to really think about how we can care for people that don't have a lot of resources and don't have a lot of support. And so again, just thinking about working with the mind of pregnant families and making them feel like they're supported is really important. But just some practical thoughts about working with supporting a person's immune system during pregnancy would be really asking the person to listen to their own inner guidance, meaning if they're feeling really fatigued when you're pregnant, that really is a time to be able to really listen to that feeling of fatigue and tiredness and to rest. So in general, in Ayurveda, we try not to rest or sleep during the day unless we're completely exhausted due to some kind of extreme circumstance. The only time that it's really beneficial to sleep during the day is when we're pregnant, because you're doing so much inner work. You know, you're creating this other being. There's so many processes that are happening. And so, you know, I really would invite pregnant people to sleep when they feel tired, and should try not to push themselves like, oh, I must continue doing everything that I've been doing before, or push themselves. It's really a time to actually be a little bit more quiet and to try to rest. And so when they're able to rest more, then that will help to support their immune system just by getting that solid amount of rest. And then also going back to basics, just making sure that they're taking in enough fluids. I mean, I'm sure you know, Christine, like in the first several weeks, in the first month or two of pregnancy, your blood volume increases so dramatically. I don't know if it nearly doubles, but that's the fluids of your body increasing. And so you need to take in healthy fluids, mostly water. Soda isn't so helpful. So this would mostly be like water and non-caffeinated herbal teas. So that'd be really helpful. So to make sure that you always have like a thermos of water next to you, and you're just getting into that habit of hydrating yourself throughout the day. So because when you're dehydrated, your mucous membranes, meaning like the inside of your nose, for example, has a tendency to dry up. And when the inside of your nose is dry, then it's easier to get infections, you know, like this coronavirus, like COVID. So just protecting yourself by hydrating, that's really foundational, and that can really help. And because we have increased demands during pregnancy, because our fluids are building so much, it's really helpful to do that.
Yeah, I definitely remember the necessity of rest during pregnancy. It was something that was almost not even an option. Like I very clearly needed to have a little bit of a nap every single day. And when you listen to your body will tell you what it needs.
Yeah.
And I think I respect Ayurvedic philosophy so much, in part because it's just utilizing common sense practices on a daily basis. It's not, and especially with pregnancy and postpartum, it's not a treatment period. It's like it's a rejuvenation period. It's a taking care, like a building period. So simple things like hydration and rest and whatever tools we have to create a calm mental, emotional environment are really the tickets here. And I also feel like it's so important to say those things, because I know for myself, I cannot be responsible enough to like get hydrated without somebody actually reminding me. It's
Yeah.
one of those
Yeah.
things that's really easy, especially if, you're pregnant and you're postpartum and you've got, other little kids to take care of and a household or work or whatever. It's easy to put yourself last. So
Mhm.
that gentle reminder is it's really necessary.
Yeah. And I love that there's also a growing field of postpartum doulas. So it's very important. I think it's really great to have a doula, meaning an assistant with the birth family as it's happening. That's really helpful. It's actually a very traditional, in Ayurveda, it's a very traditional piece of advice. You always make sure that you're surrounded by other people who have given birth. Actually, it doesn't necessarily have to be someone that's gone through the birth experience, but it's great because it can help calm the mind of the person giving birth. They're with people that are familiar with this process. It can help erase some fears, and the mind affects the body so much. So, making sure that the birth person is comfortable is really helpful. But I do love that there's postpartum doulas as well, because like you said, after you've given birth, it's really hard to think of caring for yourself. And so if there's someone there that's really there for you, maybe there for the newborn a little bit, but really there for the person who just gave birth, that's so important. A really good way would be maybe to consider having a postpartum doula come in the mornings, just to help prepare your tea for the day, some of your food, so it's all ready for you and you don't have to think about it, and it's just easy for you to access. And also just to check in with you briefly and see physically and emotionally how you're feeling. I think it's great. I'm really happy to see that field is growing. And that also would help, again, working with the mind. If the postpartum mother's mind is more at ease, her immune system is going to be able to work better as well. But in general, it is a good time after someone's given birth to, in terms of protecting themselves and the newborn and their immediate family, to kind of stay a little bit contained. I know right now with COVID, people are practicing, at least in Massachusetts, more of social distancing, coming a little bit more out of the isolation, which I do think is important, just for the wellness of everyone. But after you've given birth, it is a little bit of a vulnerable time. So that would be a time to be a little bit more contained, and to, if possible, try to keep visitors to a minimum. I think that that's an important way to protect, at least temporarily, your immune system and the immune system of the newborn, as both of them have a chance to recover from that process.
Right. It's definitely a time that just it needs space to do its thing. And if
Mm-hmm.
we let a family have that quiet, not isolated, but protected space,
Yeah.
then it's really beautiful. I do have concerns for families at this time with potentially limited hands-on care of people that can come in and work with them, or caregivers who just may not feel comfortable working in
Right.
homes. For families that are in that scenario, what would you give as recommendation to them?
So inviting communities to, I mean, this happens now, like you can set up something like a meal train. So you have people in your community leaving stuff at the door, so they don't necessarily have to interact fully with the families, but are still providing some support. So like, providing food for them, where that takes off a little of the burden of cooking. Or if like someone's lawn needs to be mowed or something like that, doing something that's still a little bit outside of their private space, but contributing. So doing little things like that can be helpful for sure, I think. Yeah, I'm trying to think if of course, there's other practices for building immunity during pregnancy. If a pregnant person wants to work with an Ayurvedic practitioner, then there can be like some very gentle herbs that help to keep ojas, which ojas just means a person's essential strength and immunity. to help keep that supported. And then trying to eat foods that are in season as much as possible, fresh foods, so fruits and vegetables, and grains as much as they can. That's great. But if you don't have access to a lot of fresh foods, high quality foods, at least bringing in the practice of, like, anyone and everyone can do this. When it's time for you to eat, to actually take a moment to just do that, meaning don't be watching a movie while you're eating your lunch, or on your phone talking to someone while you're eating food. It's really helpful for you to actually just nourish yourself and do that as its own thing, because whatever you're taking in through your senses, meaning whatever you're looking at or listening to, you're kind of digesting that. So if you're doing that as well as eating food, that can sometimes create more stress for your body, and it's hard for you to actually receive the nourishments in your body if you're also taking in like a horror movie or something like that.
Right. It's so true. It's and that's, it's a bit hard to do,
It is.
in this day and age where we have so much information available to us everywhere, on our phones, on our computers, and it can be a little bit of a strange thing to actually just sit and eat and not do anything else.
Yes. It's about changing habits, and it can be hard. So like if you've never done that before, if you've always watched the news while you eat food, or you're always, I don't even know, playing a video game with one of your kids while you're eating food, is to choose one meal not to do that and see what that's like. And it can be hard. It can be really hard to change habits, but there is a lot that we can do ourselves to really help reduce our potential of getting some kind of an infection. And so I would really love to bring that understanding to people. In time, yes, there'll probably be treatments that will help to get rid of the virus for people or other illnesses. Yes, there'll be medications, maybe vaccines, that kind of thing. They all have their place. One thing I haven't seen a lot, I actually don't really watch the news that much, but I'm not really seeing a lot about, okay, what can people do to empower themselves? And I'm glad that you're raising that question, because it's really important to know that we actually can do things, to help reduce that. And so, for COVID, there's comorbidities, they call them, or risk factors. So, a lot of us will be able to fight this infection. And it can be intense, absolutely. But a lot of us, we have to remember, can fight this infection. And then for people who are more vulnerable, like if someone has type 2 diabetes or is dealing with obesity or high blood pressure, it's really an opportune time to really work with those conditions. It's like, okay, what can we do to help mitigate those conditions so that that person's health is in a better state? And that would be continuing to work with making changes to diet, to getting better rest. Because when we're able to sleep, of course, a pregnant person, that's pretty much what you're going to want to do a lot. But if we're able to sleep, then that gives our bodies a lot of time to repair and to metabolize, meaning to digest food from the day and repair any damage that was done to the body. It's like we need the rest. And so focusing on better sleep patterns can be helpful as well. I know I brought that up earlier, but
Yeah, it's just such a time of unrest in so many ways. Unrest, obviously for the world physically, but also just mentally and emotionally, trying to process all the changes that we're forced to go through. And I really love that, you're talking, we understand immunity is ojas in Sanskrit and the Ayurvedic perspective. And we talk so much about rebuilding ojas and postpartum during that sacred window, and all the different ways you could do that. And it's just it's empowering to recognize that we can do so much ourselves to support our own experience of wellness.
Mhm.
And I think that in our way of experiencing the medical community, it is such a disempowering structure.
Right.
A feeling that we have to go to the doctor in order to get better, when we can actually apply so much to our daily decisions to help build strength and immunity. So instead of, being so fearful, we can actually recognize that there is such a great amount that we can do with simple practices. Um, and I know that a lot of people who are listening to this are also caregivers who are caring for other people, other pregnant people, other postpartum people, caring for families. What are your favorite go-tos for keeping yourself healthy? You're a mama, you're a hard worker, you're out there doing life, and it's, a busy time of life for us.
Mhm. Yeah. Well, when people were first asked to isolate more, I definitely felt overwhelmed and a little depressed at first. And I noticed that my sleep habits were kind of going off the rails, meaning I was actually staying asleep longer and or staying in bed later and not waking up as early as I used to. And at first it was okay because I think I needed that extra rest just to deal with the overwhelm of these sudden changes. But if I sleep too late in the morning, then that brings a real heaviness to the rest of my day, and it exacerbates that feeling of feeling down or feeling slightly depressed. So I know for me, if I'm able to wake up on the earlier side, so like before 7, generally speaking, that I actually feel better in my body. So that's something that I try to do. I try to make sure that I get up on the earlier side, which means that I try not to go to sleep too late. Now, as a parent, that's hard because sometimes it's the only time you have time to yourself is at night. And that is important to have a little time to yourself. Um, so it's kind of like a fine balance, to not go to bed too late, but have a little bit of time, for myself. I've gotten into doing embroidery because I definitely am getting a little bit attached to being on my phone and being on the computer. And so I'm fairly creative. So I've started doing embroidery, which is great because it's very relaxing for my mind. And I am able to move myself away from the temptation of looking at screens all the time. And, just to do this little meditative, creative thing has been really helpful. So I do that. Um, yeah, and then I just try to maintain regular routines. So I make sure that like my daughter and I are having breakfast around the same time. We have lunch around the same time and dinner around the same time. And that I feel to be very stabilizing. It's just to keep that, okay, let's make sure lunch is happening between this half-hour window. Same thing for the other meals. And that's really helpful for me.
That's great. And it's also like, it's really doable and achievable, all of those.
Yeah,
And
yeah.
that feels really grounding to not, oh my gosh, I have to change these things or do these things in order to feel good and feel solid. It's
Yeah, I think the idea of allowing yourself time to do them, to make the changes is helpful. So like when I went off routine and was sleeping in late and then breakfast got pushed late and everything got pushed, the way to get myself back on track was just to focus on one thing. Like, okay, I'll start with just trying to get up earlier. And so then that naturally made breakfast happen earlier and that kind of thing. So just working with one thing at a time to make changes can help.
I love that. I love that because we digest things best when we do it one at a time. So we'll find the most success in something if we can approach one goal at a time.
Right. Yeah. And that'll be different for everyone. I mean, I've worked with patients that, have to work night shifts, for example, which, of course, that's definitely not ideal. It is disruptive to a person's natural sleep wake cycles. but even within that structure, we can always find ways to improve. So, there's just room for everyone in everyone's life to make these changes. But, and everyone falls off the rails, like you may be doing well with practices, and then, let's just say you're just giving birth and your baby is just not sleeping well. And of course, everything's going to fall apart for a little while. That's normal too. So it's like, it's really important not to be too hard on yourself either. I was just thinking about often what will happen when people are pregnant is they start experiencing cravings. And so in Ayurveda, there's also this understanding that if you start experiencing cravings, to a certain degree, allow them to follow them. So if, like, for some reason, like I had to have a bagel with cream cheese like every morning or every time at 10 o'clock every day. I just craved that. And that's just something I never ate before. And that's a really mild example, but someone may have some strange cravings, and to a certain extent, it's really okay to allow that to happen too, when you're pregnant. As long as it's not causing any major harm to yourself, it is okay to allow that. So.
I remember being told when I was in school for Ayurveda that it was like the baby telling you what they wanted.
Exactly, the craving.
Why do I want to eat this? I never want to eat this.
Yeah, it's like the personality. Yeah, that being coming through. Yeah, which is fascinating. It's like an understanding that for a time, the mother's heart and the fetus's heart are very conjoined. They're kind of one heart. And in Ayurveda, a seat of consciousness, or your awareness, the seat of a person's awareness of life, is seated in the heart. And so they're kind of beating as one for a while. And so it makes sense that the cravings or the yearnings of the new life will come through the mother. And it's fun. It's just interesting to see.
It is. It's beautiful. It's beautiful. I remember feeling my pulse when I was pregnant and being able to feel that like little grace note of like the baby's heartbeat. Did you ever feel that? No, it's really something.
It is something, yeah. And it can shift. It can shift to the side a little bit, to one side or another. That little extra little pulse. Yeah, it comes through. Yeah. Yeah, you can also read it. I don't know if you were ever able to. You can read it in the pinky. Have you ever done that?
I've never done that, but I have heard that. Yeah.
Yeah, there's like a little pulse that will come out through the mother's pinky, the juncture of her hand and her pinky. But yeah. It's great.
Well, I am just so happy that we could have this discussion, and I look forward to more discussions with you, Chelynn. Is there anything else you want to say in terms of immunity or pregnancy, postpartum, or caregiver health?
I think that, again, establishing regular routines is great, because that creates a sense of calm, which helps the body, but it also helps the mind. So, caregivers creating a routine without being, too diligent, but just creating that structure can be helpful. And then, as the person who's going through pregnancy, these routines actually will happen sort of naturally, like listening to when you're fatigued or feeling tired, and do that. When you're hungry, you eat, and that kind of thing. Having like a very gentle exercise routine is also helpful. So just creating these stable routines can be really helpful.
Yeah, and I love, one thing that popped into my head is just the like being intentional with your thoughts and just sort of giving yourself room to experience joy and finding joy and protecting your sense of joy and peace, even when, things around us are so difficult and hard to take in. Finding little moments that will make us smile and give us a little sense, a moment of peace.
Yes, absolutely.
Yeah. Chelynn, thank you so much. Chelynn Tetreault of Lotus Ayurveda. Such a pleasure to spend some time with you today.
Oh, likewise. Thank you. Really appreciate it.